How does a fertility clinic work with a gestational carrier? So a fertility clinic works very closely with a gestational carrier agency. So there are several agencies that find women who want to become gestational carriers, and they do the initial evaluation to see if they would be a good candidate. Once we know that a woman is a good candidate to become a gestational carrier, then she is sent to the fertility clinic for a full evaluation. And so the fertility doctor goes over the medical history of the patient, obstetrical history, if they've had any complications in a prior pregnancy, also if they had any problems getting pregnant previously. And so the fertility clinic really goes more into detail to see if the gestational carrier that has been chosen is a good candidate. Once the gestational carrier is approved by the doctor, further testing is done on the surrogate in order to determine if she's going to be a good candidate for surrogacy. This usually involves doing an evaluation of the uterus to make sure that inside of the cavity everything looks normal for a potential implantation, and then to also make sure that the patient is healthy enough medically to be able to carry a pregnancy. Once the gestational carrier is approved by the doctor, then she's going to go into a stimulation cycle in order to do the embryo transfer. And so the doctor is responsible to make sure that the lining looks normal, and that the patient is being stimulated well, that she's going to have a successful transfer, and also to do the transfer itself. So then after the transfer, the gestational carrier is monitored by the fertility clinic until she is 8 weeks pregnant. At that time, after 8 weeks, the gestational carrier then is sent over to the OB/GYN in order to start prenatal care, in order to have all her testing done for pregnancy and to plan for delivery. And so the major role of the fertility clinic is really to make sure that a candidate is going to be a good candidate for being a gestational carrier, doing the treatment cycle for the gestational carrier, and then also doing the embryo transfer, as well as monitoring the first 8 weeks of the pregnancy.